regarding trauma and dissociation. A little background. My name is John Diepold. I am a psychologist. I live and work in Morristown, New Jersey, in the USA, right near Philadelphia, if that means anything. And structuring this, and there's much to do in 25 minutes, so I may be going quickly and overlooking things, and I will do the best that I can. Explain first a little bit about the origins and the background of heart-assisted therapy and some of the components, getting into some ideas and some paradigm challenges, quite frankly, about dissociation and the application of heart-assisted therapy for the treatment of trauma and individuals who also have dissociative phenomenon with it. So that being said, let me start with an evolving definition of heart-assisted therapy, and truly does evolve over the 8 years that I have been working with this. Heart-assisted therapy, or HAT, is an integrative, humanistic, and mindfulness-enhancing approach to psychotherapy. It's a hybrid of traditional and energy-based methods.
Can we have these slides afterwards?
I guess there's a way. If you can email me, I can do so.
Yeah.
Could you write your email at the tip?
Yes.
Thank you.
So in a broader sense, HAT is a holistic mind-body approach that incorporates the use of cognition, emotion, memory, body sensation, heart influence, and a stabilizing breathing treatment when hands are placed over the heart, which I call heart breaths. And there's a reason for that, and I will explain that. It's a focused psychotherapy that uses awareness streaming in concert with the body's innate electrophysiology and respiration throughout the entire process. Respiration is our inroad to the sympathetic and parasympathetic. It is a tell in terms of what's happening with the individual as they are experiencing. Now, from the traditional psychology side of things, for me it doesn't matter what orientation you were brought up in or practice or use or combine, because elements of the psychodynamic, of the humanistic, it's very, very client-centered, cognitive and behavioral components. It's holistic in multi-sensory mind-body, emotion, affect, and sensations. Those of you who have studied hypnosis, it is very Ericksonian-based in some regards, and it's very mindful in the moment for the individual. If you want to consider that, that's what I consider the traditional path. However, the heart-assisted therapy model expands and also includes the physical sciences, elements from biology and physics in particular. The energy psychology components, which is energy, of meridians and chakras and biofields, and the energy of the heart, which I will talk a little bit about. Human electrical and electromagnetic fields of influence and polarity, very, very important. Colin Ross, who is here, wrote a very interesting little book called Human Energy Fields, which ties into this work. The writings of Gary Schwartz and Linda Rusek on dynamical feedback loops. I'm not sure if you're familiar with Gary's work, but it connects to physics and frequencies and how we experience and how things change, as well as heart math research. Coupling this with basic observations that people unconsciously will touch one hand or both hands to their heart or their chest area. And if you think about what you've seen in this conference, you've seen people, I saw presenters doing this morning, they will do this. It happens automatically, spontaneously. It seems to be cross-cultural. My sense is that it's an innate form of self-regulation, which is built into this program, this approach. And it can be seen anywhere and everywhere. Ancient, old, young and old. This is an infant that my buddy sent to me, was, hours old, and he said, "You're doing it." That's one of my twin granddaughters. She was in a photo shoot. She wasn't told to do it. Doing all the move there, move this. She just spontaneously did that, and they caught it. So this is what we do automatically. There must be a reason, I think. And of course, if you're familiar with ET, you know, you get the heart going, and then that's how you do the healing. Now, the heart. The heart continues to simultaneously resonate information to every cell in our body, just as it did during the embryonic development, and for me, it's a lifelong process. The heart is the first organ that develops in a fetus. It precedes the brain. And of the over 70 trillion cells in the human body, only the heart cells pulsate. What do they pulsate? Sound waves, pulse waves, information, frequencies. And they do it right from the beginning. Heart puts out the strongest electromagnetic field of any organ in the body, and up to 5,000 times greater than that put out by the brain. If we look cross-culturally, this is a Chinese Hanzi, where they combine characters to understand the concept. And in psychotherapy, to listen, to my way of thinking, is an important concept. And their Hanzi involves these parts: ears, eyes, undivided attention, and heart. So, in my thinking, successful psychotherapy is built upon a highly sophisticated exchange of information between individual and therapists, some of which happen so quickly we don't notice, don't have the words for, but rest assured, the person that we're working with notices. And HAT is designed to maximize our ability to listen, to observe, to plan, and integrate procedures that provide an opportunity for the person to feel validated and to heal and to shift, to adapt and to move forward in their life. I apologize for having to go so quickly because some of these things are fun to discuss, but for another day. Milton Erickson. You want to rely upon the capacity of the individual patient to furnish you all the cues, the information by which to organize your psychotherapy, because the patient can find a way if you give him an opportunity. Okay? And the HAT process provides a gentle, safe opportunity for the person, providing we have a format, which is this presents, and we're paying attention. So it is very client-oriented. Everything is individual, person to person, session to session, which I think we all might expect. Now, coming in from the energy side of things, science has been teaching us since certainly in the early 70s, if not before, that we are electrical. And in particular, the body we are electromagnetic. And that means some very important things. You know, some writers have written, Colin Ross being one, that biology breaks down into chemistry. Chemistry breaks down into physics. Physics involves frequencies, electromagnetic frequencies. And the medical model has it only going down that way. But my thinking is it's like a saloon door. It also works both ways. So when there are disturbances in our electromagnetic frequencies and how we process information, it will then bump up to affecting our physics and our chemistry and eventually our biologic being. So if everything is energy and thought is energy, you know, then the energy of thought resonates with our body. And that resonance, if it's, you know, creates the sensations and the awarenesses and the feelings that we have. And if it's coherent, we feel fine, meaning the frequencies are synchronous. But if the resonance is incoherent, it's disruptive, then we don't feel good. The body doesn't work well. It doesn't function properly. And we need to account for that, in my thinking, to have effective therapy for an invitation for the person to change. So when this polarity gateway is obstructed, change is not possible. this is segmented magnets. And so, theoretically, the body is structured of all kinds of connections, electrically, magnetically. If something happens, let's say trauma, and people do their best to get together, and we all help, family, therapists, and we put pieces together and we talk, but there are some things that just don't go together. And we can talk for hours, days, and years about how important it is and how necessary it is, but this isn't changing. Unless we can account for a way to shift the energy so that it can go together, now change becomes possible. Nothing is guaranteed, but now it can become possible. And this component is, I think, a real good fit for traumatized people, which has been my experience. Now comes the concept of heart breaths. Heart breath is very simply this. A person intentionally now overlaps their hands, puts them on their heart, and I'm going to ask you to do this at the end. We'll do a little quick walkthrough. And at the beginning, they start with 9 heart breaths. 3 this way, 3 this way, 3 this way. There's a story about how that came about, which I don't have the luxury to tell, but basically patients taught me over a 2-year period. But what this little thing does with 3 and 3 and 3, it resets our energy system. It's like rebooting your computer. It's going downstairs and flipping all the circuits, making sure everything is on. Because now the system is at least ready for change to take place. Okay. Now it doesn't matter. Some people might think, well, you start this hand. It doesn't matter, because you do it 3 times, you get one way, the other way, and back. And it's critical because that's also how the hemispheres operate. So I've taken a natural unconscious act and making it a conscious, ever-present component within the therapy process to allow for that polarity gateway to be open, especially when dealing with troubling feelings and sensations and memories. You know, if you keep running into this, you know, we need to keep it open. Again, from the client-centered point of view from Carl Rogers, the curious paradox is that when I can accept myself just as I am, then I can change. Part of the process with people who have been traumatized, and I see most of the people that I see have trauma in their history. Not the big T that gets all the attention, but the little things that happen about what parents said or what friends said, what the teacher said, what the ex said. And it gets caught up in the system and it can't process. And then it resonates and it reverberates back into the system in an incoherent, disruptive way. But we have to accept that. And so, when we heard how important acceptance is when we have problems with attachment and the things that interfere with it. Now, acceptance doesn't mean like. It simply means accept. Keeps the left hemisphere happy too. Now, language is a way in which we structure our world. It's the way our people we work with structure their world. And so, Pat employs acceptance statements. And here are some examples of some acceptance statements. The person starts with a heart breath, and they say, based on what they are telling me, and I'll walk through at the end what this means, but I'm trying to give you the pieces. Deep in my heart, I love and accept myself, even though this happened to me. And then they're going to say it the second time on this side, the third time on this side. Deep in my heart, I love and accept myself, even though I feel angry. Okay? The respiration is the cue. It's a guide. It's a tell. What's happening with sympathetic and parasympathetic process. Do you know that people stop breathing when you get into certain things and ask them to be aware of something? And then it starts again. Then I slide it in. Okay, now I make my statement. It's on the parasympathetic, relaxed side. Now I can slide it in. And that is my guide. That's my tell. Deep in my heart, I love and accept myself, even though I feel sad or depressed. It's based on whatever the person says is accepted. It's valid. It's okay. And I'm there with them. I talk about mirroring, okay? A person might think I'm modeling or mirroring, but I'm connected with them. And it's an interesting phenomenon. When you have 2 people in a room or more, And you both are connected this way, and knowing that heart energy can be detected 8 feet away from the body, and I sit within 3, 4, 5, 6 feet from my person, you know, you can feel it, you can sense it. And guess what? So can they.
So you ask them to say these things or what?
I will say that, yes, I do have them say it out loud, okay, which is an interesting phenomenon too, but the reason out loud is more powerful because there's more resonance in the body, and you can literally feel it on your chest when you speak something versus just thinking something. So I'm using all the information that I know about psychology and physics and resonance to help facilitate this process. Now, there are 4 guiding principles that power the heart-assisted therapy. They are not rules, they are guiding principles because people are different. If a person shares something that is negative, principle number 1 is you teach they accept the negative. That's why, you know, deep in my heart, I love and accept myself, even though I'm angry or even though I'm disappointed. You know, when they bring up something that's neutral, has no real negative charge to it, I want them to ponder it. Okay, ponder that and take several more heart breaths. I want to see where they go with it. I accept it. Okay, stay with it. Where do you go? And if it's positive, you know, this counts too. Person says, oh, I'm beginning to relax. Okay, several more heart breaths, and just notice that sense of relaxing, or that sense of being calm. Let them sit with it. You know, the good counts too, okay? Because this is what happens. And then planning for the future, we want to give the person the best chance to progress in their life. And planning for the future involves sometimes acceptance statements and sometimes something that I call future performance imagery. If they are in situations where they have to deal with an individual in their life in the future, you got to clear out all the stuff first, kind of like a farmer getting a field. You got to clear out the rocks and the stumps and the bottles and the glass, and then once the soil is tilled, now you can start planting the good stuff, because now it has the best chance to grow.
Before you said 9, and now you say 7.
I will explain.
Okay.
Okay, I apologize. Okay, very quickly, trauma and dissociation considerations. Many experiences can prove traumatic or not. What's traumatic to one person may not be for another, or for one culture to another. The experience of trauma is idiosyncratic. There are wide symptom variability. It's emotional, psychological, and physical. And I'm going to say electromagnetic frequency ties all this together. And every individual has his or her own story. It's how they subjectively connect to that experience. Now, I heard you say, you know, the trauma is not in the story. No, but the story is the link to accessing that information, because the energy of it resonates with the body, and that's what comes into play in terms of feeling sensations. The therapeutic relationship, of course, we hear a lot about that, you know, especially the more damaged persons. The safety and trust has to be. We need to be mindful of the issues about attachment and belonging. We need to have a viable and effective treatment model. Patience regarding when and how to treat. You know, sometimes that's overlooked. I've heard, in a session earlier about, yes, take your time. Even though we may have something that can be very useful to this person, timing is real important. So as therapists, there's a lot to do other than throw a technique or an approach at someone. So I'm just reminding, the choir here. And knowing and confirming what the healing outcome is. I've had people come in and say, can you just hypnotize me and make it go away like it never happened? And I say, no, we have to work within the confines of reality. We can't change the fact that X, Y, and Z happened to you, but we can change how you respond to that. And that makes all the difference in the world. Well, I'll throw this out. What's the purpose of dissociation? It's variable and idiosyncratic, and it's based on need. first time person dissociates, they're not thinking, okay, it's a spontaneous phenomenon based on the need of that individual at that point in time. Sometimes it serves to escape. It certainly serves to help and to protect. Sometimes it creates distortion, sometimes it creates organization within a scattered system. At the bottom end, I think it's a creative psychogenic maneuver designed to help in the moment. However, I'll raise the question, what if dissociation is also a result of electromagnetic interference in the mind-body polarity gateway, where normal energetic pathways are compromised because of the emotional charge of the experience, resulting in an inability to connect and assimilate? They can't get it through. The dissociative response is not connected. So their experience is the disconnect. And if we can understand how we seem to be operating electromagnetically, then we have that opportunity for shifts and change to take place by honoring what's happening with us as electromagnetic beings. All right, here's my conceptual paradigm challenged. Is dissociation a disorder or an inorder? A disorder equals pathology, it's bad, it's without benefit, get it out of here. But if it's an inorder, it's health-preserving, it's helpful, it's beneficial. Okay? And that's the original purpose of dissociation. It's helpful, it's useful. So if that kind of thinking holds any water, then we need to maybe think and even convey to our people that it's not a disorder, it's an inorder, originally designed to help you in some way. However, the in-order component of dissociation can be self-sabotaging. That's usually what brings people in. It gets them in trouble, their family bring them in. It becomes self-sabotaging because they don't need it now or don't want it now or in these kind of circumstances. So dissociation to me is not the problem, however, it can be problematic. And what therapy needs to address is the cause for the need to dissociate. Another paradigm challenge regarding individuals with DID diagnosis is the concept of an alter versus my term of a resource. An alter is a common descriptor which promotes separation and not me, a different personality. Whereas resource kind of reframes the phenomenon because it's a naturally emerging and whole-based given the circumstances. It is me protecting myself. It is a me from a different perspective, but it is a me, whole me. So in working, if you're working with DIDs who have distinct personalities, you can modify the acceptance statements. For example, deep in my heart, I love and accept all of me, even though whatever, okay? Or, and this is the less prevalent case, and again, I'm going so quickly because how do you decide how to do this? Deep in our heart, we love and accept all of us, even though. So the point is the language of acceptance statements conforms to how the individual is organized. You know, that's, the individual teaches me what needs to be done and how we might need to go about it. And in 2 minutes, this is the very, 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 very quick example of how this is set up in the easiest possible way. Okay? One of the biggest concerns I have is from where I've come from my training and learning and teaching is now I've come to simple. And it's just as challenging to teach simple as it is to teach complex. So after assuming that we have a good rapport, we have a good history, we have where we're going to work on, we know where the upsets are, we select a target, or what I call a treatment focus. You know, it was something that your brother did. Okay. And they agree, okay, that's a good place to start. And, well, I'll just use that for an example. So the first thing we do to start is, okay, I invite them to, and you can do this with me now. Just overlap your hands and put them on your heart. And just free your mind, just kind of blankly focus on something across the way. And take 3 nice, easy respirations, or what I call heart breaths. reverse your hands. And 3 more. And back again, 3 more. That's kind of a system reboot. Everything is set. You probably notice it feels good, it feels comfortable. Notice it's just your own natural respiration, not diaphragmatic breathing or deep, hold breaths. It's just because your body recognizes your own pattern. So 3, 3, 3. Then I invite the person, okay, several more heart breaths. Now think about what your brother did to you. And now I watch, and I listen. And I'm watching respiration. I'm watching facial expression. And usually I wait about 3 respirations, or if they really kind of make it something, then I'll say, okay, what are you aware of? Is why it's called awareness training. What are you aware of? What are you thinking, feeling, sensing? What are you aware of? And then they tell me. And I listen to what they tell me. And I'm listening for those guiding principles. Are what they're sharing, is it negative? Is it neutral? Is it positive? They're the 3 things I'm paying attention to. You say, oh, so I'm just feeling this tension in my body. Okay. Heart breath. I say, deep in my heart, I love and accept myself. And they say, deep in my heart, I love and accept myself. Even though I'm feeling this tension in my body. Even though I'm feeling this tension in my body. I watch them breathe. They complete a respiration. Back the other side. Another respiration. Deep in my heart, I love and accept myself. Even though I'm feeling this tension in my body. Again, I'm watching the respiration, full respiration, shift back for the 3rd time. After the 3rd time of saying it, I invite them again. Several more heart breaths. Think again about what your brother did to you. And so it goes on like that, catching everything that comes into the awareness. Now understand, this isn't just a one-shot deal, you know. But believe it or not, sometimes it is, but don't count on it, okay? Because it's just amazing how people connect and what they associate these experiences to. It doesn't matter to me. To me, I tell them, it just is what it is. Okay? I go and accept whatever I do. And we go through very quickly what the protocol would be. You go through until, now notice when you did this, how many people had their left hand on the right? Do you remember? Just do it. Okay? How many have their left on their right? How many have their right on their left? It's about half. You figure. It's yes. But if you switch it, if you switch the other way, it just feels different. Why? Because of polarity. Okay, coming off the heart and the polarity of the hands, it feels different. So what I learned is that after I clear a person on this side, then I have to say, okay, switch your hands, and several more heart breaths, thinking again about what your brother did to you. And lo and behold, there is often a whole slew of other information that got stored and accessed electromagnetically a little differently. And I go through until this is clear, and this is clear back to back. That's the quick and and so...
when do you stop? Because then you take everything that's come up and you say, deep in my heart, I accept this and this.
I take everything, and I take it in chunks. Okay? Some people have the gift of gab. Okay, one of the things when I teach this is the hardest thing is to teach therapists to be quiet. Just to say nothing and wait. Wait for the opening. And you use their words, their language, as much as possible. Because that's what they resonate to. It's their words. It's their experience. And at the very end, if you have a difficult, traumatized person, at the end you say, deep in my heart, I love and accept myself, even though we have to stop for now. And then clear your mind and take those 9 heart breaths again. Take 3 this way, take 3 this way, 3 this way. It's very grounding, very calming, and it's a tool that they use in between sessions whenever they start to get, okay, they just free your mind and do those 9 heart breaths to settle. And I'm turning into a pumpkin. Let me see, just do this. How does a mindful, grounding, empowering, self-nurturing experience that facilitates acceptance, self-regulation, insight, and accelerated information processing, and healing that is system-wide, part because we're engaging the heart, and the heart is constantly communicating. It's a dynamical, coherence-making reconsolidation model that targets the source of the psychological distress, which is what you determine with your person. And it serves to shift cognitive, emotional, somatic, and corresponding biofrequency resonance toward an interference-free coherence relative to what the person is thinking about. So you get this incoherent, disruptive to, because we can't change reality, but we can shift. When I think about it now, they say, nothing there. No, nothing, gone. They still know the event happened, they can still think about it, but the incoherent resonance is gone. So that being said, I got the hook, I'm off of here. Thank you very much for spending your afternoon and listening to the
Please write your email address.
Yes, I certainly will.
And what was this,
And
7?
maybe we have questions at the end for all three. Maybe that's an easier way to do so we can make this transition. Okay.